Our practices are becoming more and more technologically advanced, whether it be a patient checking in online through a practice website, or whether it be digital radiography that allows you to shave maybe 30 minutes off of an endodontic procedure. So my question is, why is it that when somebody comes in and you're going to write a prescription or you need to look up a medication, that we reach for one of these? A book. I mean, they're big, they're heavy, they're inefficient, they're easily outdated. And I'm lucky enough today to have Brad from Lexi-Comp here, and Brad is going to teach us how to beat the book. Brad, what have you got for me?
Thanks, John. And what we've got is basically an electronic platform where you or your staff can enter in multiple medications into the system, and the first thing it's going to do is alert you if those medications, over-the-counters, natural products and herbs may alter treatment. I'm sure you have patients once in a while come into the office with many drugs. A whole laundry list probably of drugs.
I have patients walk into my office and they'll say, Dr. Flucke, here's the list of medications that I'm on, and this has changed since the last 6 months that I was in your office. And it's hard to keep track of all of this, so you can help with that with this solution.
Exactly. And you can have your staff print out a medication form for them to fill out in English or Spanish, and quickly and easily enter into the system and summarize for you what you need to know as a busy practitioner. The other thing they can do is compare those medications and herbs and over-the-counters against what you use in your office.
So if I have a patient come in and maybe they've got the laundry list of 10 or 12 medications, and they put that into the system, then the system's immediately going to alert me and say, you can't give this person this medication, not because they're allergic to it, but because the other medications or the over-the-counters or whatever they're taking is not going to react properly with that. Is that what you're saying?
Exactly. Sure. And the last thing it's going to do is help reduce liability for you and your office.
Okay. One of the things that I really don't like about books is that by the time this goes to the printer, all the data in this stops. How frequently is the database updated?
Great question, John. The information is updated real time every day. It's a web-based platform, so that it's not like a book that goes to the printer and goes out of date. We update the information every day. So all the new drugs as well as indications change, every day, and it date stamps those drugs electronically, so you know when they're last updated. The other thing I want to mention is it's available on any type of platform, John, for your iPhone, your BlackBerry, Pocket PC. And the nice thing is that it's all medications. It's every drug over the counter that a patient may be on when they come into your office, but it's dental specific. So it's the information you need to know as a practicing dentist.
So it's not a program that you have to install on the computer. It's not something that runs on your network necessarily. This is available over the web. So anywhere that I can enter my username and password into the website, I have access to that information.
Exactly.
Whether it's at home, in a hotel, at a friend's house, when I get an emergency call, whatever.
We've got about a dozen different databases that are into this reference library that if you just want to access, a patient comes in with a lesion in their mouth, a red lesion, you can quickly and easily punch in red lesion and look up that lesion and give you a differential diagnosis, diagnostic steps, and then treatment recommendations linked to the drugs.
So you're telling me that not only do I get the drug information, but that I can also then get information on pathology with photos?
Yeah, as well as all your x-rays and radiographs for hard tissue bony lesions. But the power behind it is really the time saving with these baby boomers on multiple medications, and you can quickly and easily know how they're going to impact your practice. One other thing we can do is print off a leaflet about that medication that you might prescribe for your patient, or even a medication they're on, in 14 different languages, and it's written to the 3rd grade reading level, so they understand what to do if they miss a dose and those side effects and what they need to be concerned with.
Okay, it's one thing to talk about it, but it's another thing to see it. Brad, show me the demo.
Sure. John, it's simple, easy to use product. Simply and easily your staff can print out this form for the patient by clicking this button right here. In English or Spanish, fill this information out, all the over-the-counters, all the prescriptions, and all the herbs and natural products they're taking. Once they hand that to your front office staff, this is the area where they simply just type them in. As you type the first couple characters, they'll pull up for you, so you don't even have to know how to spell the drugs. From here, all you do is set office regimens, and it's going to compare these office regimens against what the patient's on and give you what we call an alert. And it's an alert summary on each one of these medications they're on and what they're used for, as well as do they affect dental treatment, as well as can you add local anesthetic with vasoconstrictor, and anything else that you might need to be aware of. Patient comes in with a red bump in their mouth. Just type in red lesion. Search, and you'll see there's about a dozen different red lesions. Click on it. Pictures pop up, as you can see, and how to diagnose, how to treat, differential diagnosis, and medications to treat those lesions. Same thing with white lesions. Just type in white lesions right here, and that's how you can pull it up, see all the images, identify it, and then how to treat it. I know you were mentioning you have quite a large practice, and you want to make sure the whole staff is very comfortable in case patient has syncope or passes out.
Absolutely.
And everyone's comfortable with basic CPR and AEDs. So all you do is click on the dental office medical emergency manual, and you can print out a 1 or 2 page summary of all these different scenarios in the office, what the staff needs to do in case this happens, and what they do while 911 will be in transit to your office.
So you don't have to invent the wheel. The wheel's already been invented for you. You just have to print it and then just distribute it to your staff.
Exactly. And they have access to, like I said, all these databases at the tip of their fingers, and they're updated real time.
It's an amazing platform.
Thanks, John.
Tons of information. Bottom line, what's it cost?
Good question. You get all this information for a very, very reasonable price. It's less than $25 a month. For a Catapult member, they get $100 savings. Instead of $399, they can have access to all this information for $299 a year, which again, less than $25 a month, to save time, improve patient care, as well as reduce liability.
Thanks, Brad.
You're welcome.